We'll talk through the data as we do every week. Last week, I did send the information to all of you commissioners and county administrator. So active cases have been fluctuating a bit. As we did see in November, they were at 523 on the 22nd. Then on the 29th, they dropped down to 386, and then 395 December 6th, so a little bit up and down. And then currently, the information that you have in front of you is so the December 6th, 395, and then December 13th, 378. And so again, we're a little bit up and down. We're still confident. We're hoping to trend down a bit more in this fourth wave, but that's the numbers currently. We see the active cases in Minnesota, December 6th, 34,194, and then December 13th, 35,033. So active cases just up a little bit. In Cass County, December 6th, they were 825, so they were up quite a bit, and then the 13th now 697. And then in North Dakota, it's 2,833, and then December 13th now, this week is 2,236. So we're seeing, again, a fluctuation in some of the cases. The active cases by age, as we go through the age breakdown, we still continue to see the highest number in the kids and adolescents. As you can see, the 10 to 14-year-olds, 47. And then we see numbers, the 30 to 34-year-olds as well, 42, and the 5 to 9-year-olds, 39. So we are seeing some of the higher cases in the younger population. The cases per week, and you can see this is broken down a little bit more of overall cases reported since August, which is right around the time we were seeing that numbers climbing after the summer lull. So numbers dipped the week of November 21st, kind of Thanksgiving week, but then we saw an increase the week of 11/28, so November 28th. And last week, 175 cases were reported so far. And again, as we've mentioned every week, is that's a preliminary number until they catch up. So those are the cases per week, which we thought was a little bit easier to look at than this next slide, which is a little bit more detailed. And these are the case trends per week, which is a bit more accurate, but since the beginning of the pandemic in March 15th. So it's just a broad overview of, as you can see, the waves and where we currently are. So again, we're in the fourth wave. Haven't really sustained the downward trend, but we're certainly, hopefully we've reached the peak and are still going to see those numbers decline. Cumulative cases by age, and you can see again the cumulative cases, the 20 to 24 at the top, 14, 19, and this has been since the beginning of March. So total cases, 12,606, and that's the breakdown we look at every week for the cumulative cases by age. The next one is, as we follow all of the information here, we're watching the CDC level of community transmission. This shows in Minnesota, all but one county is in the high transmission level. So one county dropped down to substantial, and sometimes that will fluctuate, but the rest of them are all at high transmission. Here's our Clay County total number of deaths. We have 111 so far. Unfortunately, there's been 7 more deaths that have been reported since our last board meeting, so a total of 111 since the beginning of the pandemic.
Kathy, did those 6 all happen within that time frame, or is that the time when they
Not
reported?
Yeah, Commissioner Mojo, not necessarily, because some of that, there's some delay in some of those deaths tracking. Is that your question?
Right, just to look at that graph, it looks like that one week was particularly devastating.
Yes, it does. And sometimes it's not always that it's just within that week, but sometimes there's a delay in that reporting. So that could be very well the case. Hospital admissions, residents per week. So 8 admissions so far for last week, and these are the Clay County residents. So there's a graph of all those admissions for Clay County residents since March. And then we have hospital capacity information for our local health system. So we have Ascension, Sanford, and also the VA. So the staffed beds continue to be a concern as we look at this graph. At this point in time, there's a total of 4 staffed adult ICU beds available in Fargo and 1 pediatric ICU bed that's available. So statewide, in North Dakota, there's a total of 11 ICU beds for adults and 7 for pediatric ICU beds. So again, this continues to be an issue with not the number of beds that we would like to be seeing. North Dakota hospitalization data. So as we look at this graph, it remains about the same. There's a total of 165 patients admitted and 14 in the ICU, 2 current pediatric COVID patients that are hospitalized. This is the same graph we use all the time through the Sanford Health System, and it's updated as of December 7th. So we continue to see the same trends. And what is the most important is the number that we see for hospitalized in the ICU and on ventilators. And again, the majority of the patients that we see are not vaccinated. 35 of the 37 patients on ventilators are not vaccinated. So it's just really, showing the importance of, as we've continued to state all along, the importance of having your vaccinations against COVID. Our breakthrough cases, we see the breakthrough cases in Minnesota of a 3.513%, hospitalizations are a 0.142%, and breakthrough deaths, 0.025%. So still low numbers. What this is telling us is the vaccinations are really protecting people from having severe cases, hospitalizations, and deaths. So there's still a strong protection from that. Statewide vaccine data. So you can see people with at least 1 vaccine dose. We're seeing now the 3,692,000 at 70.8%. And then people with a completed vaccine series of 66%. And that's Minnesota residents 5 and over that are fully vaccinated. So 1.3 million boosters and 3rd doses have been given statewide. And then on the bottom is the breakthrough of the percentages of each of those age categories as well. Total doses by public health. So we continue to provide vaccine clinics 2 to 3 times a week. So there's the total number from January, and so we've provided 18,417 doses of vaccine since the beginning. And then this last week, there's the number of vaccines that are administered, as you can tell. So 294 that week of the 6th through the 10th, 294 total doses. We're really seeing less and less people coming in for their 1st and 2nd doses. The 3rd dose, booster doses, are 204, so that's good. People are availing themselves to the booster doses. And then as you can see, the pediatric doses, the 5 to 11 age group, 1st dose is 34 and 2nd dose is 43. So we're providing vaccine clinics, which allows parents to come in. So it's after school, it's into the evening, sometimes till 6 or 5:45. So we're trying to meet the needs of people bringing in their children to get vaccinated. So we're trying to do them as often as we can, and that's working out pretty well. So I think there's many opportunities to get vaccine, and ours is just one of many, but they can get their vaccine through their providers, especially with the pediatric doses. Some of them are choosing to do that, and then the pharmacies are also still providing vaccines. So the message really is nationwide too, is to really, when it's time for your booster, get your booster doses. So the Moderna and the Pfizer. There's a different timeframe when you are available to get your boosters, but we're really encouraging people to continue to get the boosters. You know, we have the Omicron variant and the main message is continue to get the vaccine, continue to get the booster doses as CDC, you know, continues to study this new variant. And so, you know, it might be more easily spread than the original one, but it's still under study. We still have the Delta variant that's circulating as well. But right now, this is what we have. The doses, the initial doses of your vaccine, and then the booster doses. So it's still very important to get your booster doses when you can. So that's our message. That's the most important thing that we have to protect ourselves from the variant strains that are still circulating. In Minnesota, as you all know, that Omicron variant is in Minnesota. I'm sure there's many states that it's already circulating that's been, they've been able to isolate. The other states that they aren't quite sure of, it's just a matter of time before that will be circulating through. And so the message is really get your vaccines. Breakthrough cases can happen, but you're less likely to get severely ill or hospitalized.
Do you make home office visits? You talk to people who don't want to take it?
You know,
Got a couple names for you.
Yeah, you know what? You can give them to me because we are very conscientious that there are some homebound individuals, and I have nurses that will go to their homes and provide the vaccine to
Glad
them
to hear
because
that.
they're homebound, and some are you know, it would just be really a hardship to get out of their home for multiple reasons. So I have nurses that are very willing. We take names, and when we can get out there and get to their homes, we'll do that.
I mean, we're getting down to that.
Yep.
We gotta tell people that won't go. We're getting down to that. We gotta tell them, take the shot.
Sure. And we've had some requests, and we've been able to accommodate that. So we offer vaccines also to the homeless shelter, and we've been to some of the long-term care facilities that need to get vaccines to some of their new residents. So we're pretty mobile. We get out to those locations.
Just talk a little bit about the breakthrough cases. So the vaccines first started showing up in late January, I believe,
Yes.
February timeframe, and here we are in towards the end of the year in December, and the breakthrough cases in Minnesota are 3.513%, and that I think to me it's proving that the data that was told to us when these vaccines first came out was accurate.
Correct.
Because they never said that once you get the vaccine, you were going to be 100% protected or effective, maybe a better word to use, but they did anticipate that it'd be 90 to 95% for both the Pfizer and the Moderna.
Correct, yes.
And so with that much time involved and us being at 3.513 that did get the vaccine and still get COVID again, that's actually better numbers than what they originally talked about. So it's, from a protection standpoint, it should even give more credence to the fact that vaccines are working and you should get them.
Yes, very good point, Mr. Chair, absolutely. You know, when we talk about the influenza vaccine, it's the same thing. It's never 100%, but the people that are getting that influenza vaccine are protected from the severe illness and death, hopefully most of the time, so.
Yeah, and those with the vaccine, you got about a 99.85% chance of not being in the hospital,
Correct,
based on our numbers here.
that's right.
And you got about a 99.997% chance of not dying
It's pretty significant,
if you have the vaccine.
that's right.
Just a little extra. Anything else for Kathy today? All right, thank you, Kathy.
Okay, thank you.
So one last thing, on the, I'm starting to see more and more entities, agencies, school districts, and those types of things now regarding mask issues. Can we start looking at that again in terms of campus? I think we should be reviewing that.
Next week would be a good opportunity to review that. As you all could see, that Moorhead schools have made some changes, and we meet with the superintendents weekly. So we're aware of, they had some concerns even about quarantining, and that's changing in their school system. They really want kids to be present and not miss those opportunities for education. So we're aware that that's happening, and yes, we definitely should talk about that next week.
Thank you, Kathy.
Thank you.